So after recognizing the whole process, we found that there are many factors in the existing hospital management and operation system that directly reduce the efficiency of the hospital. For example, after a patient fills out a form at the reception desk, the nurses and doctors who follow up with them ask the same questions on the form over and over again. So there was a lack of communication between the doctors and the nurses. Also, there were many factors that contributed to the variability for both nurses and anesthesiologists at other stages of the appointment as well, like phone calls, disorganized charts, or the need to consult with a colleague could all add time to an appointment. And the variability was reflected in a standard deviation of 21 minutes for nurses and 29 minutes for medical doctors. In addition, surgeons were responsible for determining which kind of patients are required to enter PATA and deciding their appointment priorities based on their patients' cases. Normally, most complex cases had priority, but the cases that fell into this category, however, were not well defined. This lack of clear guidelines plus variability in surgeons' assessments often resulted in sick patients not being sent to PATA, while young and healthy patients were scheduled. On the other hand, there are also some bottom lines that PATA would not touch. First of all, they don't have sufficient funds and do not want to invest too much on the improvement plan because they believe the root cause is the inefficiency of their current operation and management system. Secondly, since PATA is unwilling to reduce the number of patients they serve or have additional rooms and staffs, the focus should be on how to run the clinic better with the resources they already have. Well, next, we'll talk about some targeted solutions to the factors that reduce efficiency, as I mentioned above.